Good afternoon, and thank you for being here with us today. I'm excited to introduce you to Dr. Vallis and Dr. Fraser. Dr. Fraser has been a great support to me throughout my journey to becoming an occupational therapist, and Dr. Vallis has mentored me during the program as well as this project, and I'm grateful for their invaluable guidance and supports throughout my journey. Today, I'm thrilled to share with you the result of our recent project. This project has been a great learning experience for me, and I'm eager to share with you what we have gained throughout this process. As you all may know, this project has focused on applications of 3D printing in clinical settings, and by the end of this presentation, I will provide you with more information about the statistical and tangible outcomes of the project. Once again, thank you all for being here, and I hope that you will value the work that we have accomplished in the past 12 weeks. Here is the agenda of today's presentation. First, I will discuss the project's objectives and what we have aimed to achieve. Then, I will dive into literature and the evidence we found to support our work. Then, I will dive into the literature and the evidences we found to support our work. I will also touch upon the limitations we faced during the project. After that, I will give a brief overview of our progress and achievements so far in a project, and finally, I will share the pool results and introduce the two winners of the project. Based on the feedback I received from you through surveys, interviews, and your input during my clinical rotation, I realized that there was a need to explore alternative approaches for providing tools and devices that could enhance veterans' occupational engagement and quality of life. As a result, I proposed this exciting project as a doctoral capstone to my school and the VA's OT department. In fact, the need assessment showed I was not wrong, and majority of you believe that learning 3D printing will be beneficial, and OTs should incorporate such a technology in their interventions. But let's see what were the rationales behind this project. First, the OT department intended to utilize 3D printing technology. Ben has been using this for a while. Literature and evidence support 3D printing technology benefits for OT settings. Also, 3D printing technology is versatile and flexible, and you have seen that throughout the project by the assistive devices we have made. It is also fit well with my interests and background. It is inexpensive, and most importantly, the majority of you were interested and had huge momentums to learn how to 3D print. To be precise, 82% of you showed a desire to learn 3D printing technology. In fact, more than 20 years of experience in the field of technology and 9 months of detailed literature review, and of course, with invaluable guidance from my faculty advisor, Dr. Vadis, and my community partner mentor, Doug, result in 14 weeks educational project that was including theoretical materials and hands-on lab. Although the primary aim was to develop new skills to enhance your practice using an advanced technological tools that can help you to address more complex issues, increase veterans' occupational engagement and overall satisfaction, promote independence and compliance with home exercise programs, add a new skill into your OT toolbox, and in my opinion, most importantly, illustrate OT's distinct values and capacity. So, during this project, we gained the essential knowledge and skills to effectively utilize 3D printing technology, including the ability to integrate it into our OT interventions. We successfully maintained our roles as occupational therapists while also expanding our versatility and problem solving skills to enhance the capability and capacity of 3D printing technology. As leaders, we invited professionals from other disciplines to collaborate with us and guided them in utilizing 3D printing technology. Through our efforts, we showed the extensive potential and diverse abilities that occupational therapists possess to serve and lead the community. But let's see what literature says. In the recent years, occupational therapists have begun to exploring the potential of 3D printing technology and improving the delivery of services. Escol et al. Conducted a level 4 study and investigated the emerging practice of occupational therapy in mainstream education in Switzerland. The authors investigated pediatric occupational therapists' practice experiences and clinical reasoning when working with children with special needs, and suggested that the using of technology and establishing reliable, effective, and cost-efficient tool and clear guideline for emerging areas of practice is a necessity. Portoni et al. Published a level 3 case study in 2022 and compared the effectiveness and user satisfaction of 3D printed finger orthoses versus manual orthoses prepared by occupational therapy students. They tested 3D printed oval 8 orthoses for swan neck deformity. They had 36 OT students divided in two groups of 18. One group used 3D printer to make an orthosis and the other group made manual swan neck orthosis. The results suggested 67% would prefer the 3D printer since it can be used to make effective, cost efficient, and more complex orthoses. Jensen et al. Also published a level 4 study in the Journal of Hand Therapy back in 2020, reported that 3D printed personalized assistive devices can address the effectiveness and cost of such devices, in addition to comfort and pain in individuals with rheumatoid arthritis. Lee et al. In their level 4 study concluded that patient specific assistive devices optimized for brain injury patients' functions created by 3D printing technology provide low cost and effective alternative for disabled individuals. A pilot study by Shin et al. Investigated using 3D printing technology to create patient specific wheelchair joysticks for individuals with quadriplegia. The study suggests the potential of 3D printing technology creating personalized assistive devices that can improve the delivery of occupational therapy services. A level 5 study published by Policies et al. In 2018, a case report published by Knight et al. In 2019, and a design-based research study focused on developing and testing a collaborative co-design process for 3D printed assistive technology published by Aflatuni et al. In 2021 indicated 3D printing technology's versatility and flexibility. For instance, Knight et al. Developed customized prosthetics for soldiers who lost a limb in combat. Or Policies et al. Used 3D printing technology for surgical planning and practice. In addition, a level 4 case study published by Vesco et al. In 2018, a level 5 expert opinion study published by Novsky et al. In 2021, and a level 1 systematic review published in 2021 by Horsandi et al., have shown the same perspective through their work. In a research methodology, 14 participants with disability used customized assistive devices made with 3D printers. The study was published in 2020, and the results showed that the 3D printed assistive devices were effective in improving the individual's ability to engage in daily activities and performing occupational tasks. In addition, Dudley et al. Investigated how incorporating 3D printing technology in OT interventions and concluded that customized 3D printed assistive devices can significantly improve the quality of life, occupational engagements, and independence of individuals with disability. This is also supported by several studies on using 3D printed assistive devices in OT settings. I just want to briefly mention the Dudley et al. Work. The authors made a 3D printed hand exoskeletal for a post-stroke patients, and all three assessments they used, including Fogelmeyer, box and block, and EMG activities, showed enhanced grasp and finger movement. In addition, works of Knight et al., Novsky et al., Vesco et al., and Policis et al. Made it clear that incorporating customized 3D printed assistive devices and therapeutic tools can improve quality of life, occupational engagements, and independence. Also, another level 1 systematic review was published by Al-Khatani et al. In 2021, suggested that 3D printing technology in OT interventions allows providing customized assistive devices that are tailored to individuals' needs and requirements. Also, 3D printing technology allows rapid prototyping, which enables OTs to quickly make and modify designs until the perfect solution is found. And now I think we illustrate that really well throughout the project by starting a design and developing that throughout the process to making that best suitable for the veterans we were working with. On the other note, Aflatuni et al. Indicated that lack of framework and guidelines for OT participants in using 3D printing technology is a significant barrier on its adoption in the field. In addition, the development of standardized guidelines for design, manufacturing, and implementation of 3D printed assistive technologies in OT could help ensure quality and consistency in the use of this technology. Also, collaboration between occupational therapists, designers, and end users in the co-design process can help ensure the technology meet the specific needs for each client. And we were following these quite well throughout the project. And finally, Maraz et al. Published a level 4 study in 2015 along with Angel et al. And Aflatuni et al. All concluded that OTs have a crucial role in assisting clients in achieving their occupational goals. However, OTs' technology literacy could hinder OTs from adopting and utilizing new tools such as 3D printing technology. While there may be challenges with technology literacy among OTs, a growing body of evidence shows the benefits of 3D printing technology in occupational therapy. Therefore, it is important for OTs to continue developing their technical skills and knowledge to fully utilize and understand technological tools, including 3D printing technology, to support their clients' occupational needs. Additionally, a framework and guidelines for using 3D printing technology in occupational therapy should be developed to help OT practice in utilizing 3D printing technology. And I think these are the great points, and these are the areas we try to cover throughout the project to develop some kind of guidelines and framework to enables you to start from point A, go to point Z, and have that assistive device ready to use. Throughout the project, we employed three main strategies. We have learned basics and required knowledge to work with, manipulate, and maintain 3D printers. Also, how prepare and print a 3D design, as well as select appropriate material based on applications. And we learned about typical problems in 3D printing process that we may face. We also applied the knowledge in the form of hands-on experiences to challenge our comprehensions, and based on the feedback we received throughout applying the knowledge, we modified our approaches to learning, teaching, and utilizing 3D printing technology. And based on your performances on the quizzes and the assistive devices you have created, I can conclude this was an effective method. Now, I want to talk about some of the limitations that hinder us to even progress more and how we address this limitation in this project. I have to mention that all of the limitations were dynamically interacting and affecting each other's and the project with various magnitudes. Since this was a student project, there were many rules and policies enforced by the school that hindered further advancement and expansion of the project. Hence, except for the limitation rooted from the nature of the project, which imposed many limitations by itself that could not be fully addressed in the scope of this project, we were quite successful in other areas. For instance, your flexibility for participating in a project on your end and spending more time on my end was the best strategy to go around this limitation. Although still the short length of the project was a barrier for all of us. In terms of equipments, well, the allocated budget to the project just was sufficient for part of the supplies, but because of my personal interest and faith in the project, my personal investment was sufficient for at least duration of this project. But definitely we're going to need more versatile and advanced 3D printer to expand on the use of 3D printing technology at the VA. Also, for the lack of evidence to help avoiding unnecessarily issues and problems, we were able to fulfill it by try and error. Also, I was relying on your experiences, and that turns to be a grateful strategy as well. I would like to start the achievement part of the presentation by a quote by myself, which is being an occupational therapist is not just a job, it's a calling. It's a commitment to help others and make positive differences in their lives. During my clinical rotation here at the VA and this project, I learned from you how to be creative, collaborative, fun, and humble. Learn from my mistakes and experiment and modify my knowledge. And I appreciate that. Indeed, words cannot express my sense of appreciation of your knowledge and your help and your supports. To assess the effectiveness of the devices we have made, I have developed a standardized assessment based on a Quebec User Evaluation Satisfaction Assistive Technology, or QUEST in short, and I inquiry about the size, weight, adjustability, safety, durability, simplicity of use, comfort, and effectiveness of the devices we provided. And based on that assessment, we scored in average 4.88 out of 5, which translates to 97.5. This was a huge achievement for myself and the project, and of course for your effort in this project. I used pair t-test to compare pre and post assessment scores, the surveys you answered at the beginning of the project and at the end. Calculation returned p-value of 0.03, which shows a positive statistically significant changes in the areas of perceived usefulness, perceived ease of use, self-efficacy, attitude toward use, and intention of use of 3D printing technology. And again, this is another indications of your capacities to learn new technology. I also found it beneficial for all of us to review a specific part of the assessments. And as you can see, 3 out of 5 have shown a bit of hesitation to use 3D printing technology compared to pre assessment data. My interpretation is this is absolutely normal because you have engaged in novel learning experiences and have engaged in many challenges and limitations throughout the project in a way to utilizing 3D printing technology. Actually, this is a good indication that how even a small limitation can affect your perception and understanding of use of a new tool. I'm confident that this would not be an issue for any of you for using your skills in 3D printing. I know you all are familiar with this website. This is the result, I should say, part of the result and outcome of or effort to this project. And since Dr. Vallis and Dr. Fraser might not be much familiar with this website, I just want to talk about it today. We have all of the designs we created throughout the project in this website, as well as resources section, which consists of all of the lectures and learning material we provided throughout the project, and all of them are available in form of lecture presentations and podcasts that can be used in future if you want to refresh your minds regarding the 3D printing. Also, in the blog section, we have developed handouts for 14 common disorders and injuries we are working with at the VA, and each of these handouts are consist of definition of the disease, disorder, or injury, type of assistive devices can be used to help the individuals dealing with this type of issues, and exercises and other helpful information in terms of how we can engage the individuals more to their occupational tasks. And these are all evidence based and can be used for educating veterans throughout the treatments and interventions. I also want to mention that all of the devices we have in the in this website have been designed here at the VA, and we're not breaking any copyright law, so we can say we have created this stuff, and we can be proud of our efforts throughout the project to create such a significant changes in our understanding of such technology. These are my references. Um, Again, as I mentioned, I have reviewed many articles in the literature, and these are just the evidences I used to prepare this presentation. But if someone needs more evidence in terms of use and applications of 3D printing in rehabilitation settings, I can forward all of those articles to you. Now I'm excited to introduce you to winners of this project. Based on the pool you participate in and your votes, Ellen and Linda were selected as the winners of two $50 gift card. Congratulations to all of you, especially to Linda and Ellen, for winning these prizes. I wish I had the option to provide all of you with at least a prize, since you put great deal of effort in this project, and I'm grateful for that. Now I'm answering any questions if you have. Otherwise, again, thank you for being here today, and I'm pleased to announce that we successfully implement the 3D printing technology in a field of OT and in a clinical settings. And thank you for your help and your support throughout this project.